Hi, good morning, everybody. Nice to see you. Good morning. Nice to see you. Some familiar faces and some new faces, which is great. So we have a special guest in today, which is fantastic for our Wellness Wednesdays. It's Dr. Ryan, and as you can see, he's going to be discussing and introducing you to natural approaches to immunity. So, the floor is yours.
Very kind. Do I need to use this?
No, you don't.
Is this all connected? Yeah. Good. Well, good morning. It almost feels like COVID days. Everybody separated like that. Okay. So I had a good COVID, so it's not bad memories. So, okay. Well, what I would like to do is just ask you to want to leave here today with something that is valuable to you or your family that you could go ahead and use immediately. So my intention is not here to lecture. My intention is not here to promote anything, really. The idea is when Devika contacts me from time to time and says, can you come give a chat? It's usually an opportunity for me to catch up with her and see her, so I usually will say yes. But then I get the opportunity to meet people like you and hopefully share some of the things that I've had the opportunity to learn over the last nearly 30 years of being involved in general family sort of practice. So the subject today is very much clear. It's on immunity. And the way I would normally just introduce it is the things that we would like to be able to do are figure out how can we become sick less frequently, less intensely, because illness for ourselves or illness in the family ordinarily becomes quite disruptive to an already busy day-to-day life. So I do not want to necessarily come and present a lecture. I would like it to be very much engaging, and you've already facilitated that for me by giving me a whole lot of questions. And when I started looking through them yesterday evening, it was an opportunity for me to see that there's a lot of overlap. So I think in the time that we have together, we'll be able to cover a lot of ground that really comes through the questions themselves rather than me, trying to present an understanding of what's happening in the body or, how we try and reduce communicable disease and those kinds of things. But in principle, let me say that my approach to health and well-being has always been holistic. And what I mean by that is I think optimal health and function and well-being is largely dependent on how we think, how we eat, how we move, how we rest and recover, and then how we support those behaviors and those things that we do with supplementation, with natural therapies, with conventional medicine, or surgery when required. So my approach to medicine and health is very much an integrated one. I am not, even though I'm trained as a clinical homeopath and a nutritionist, I am not bound by a particular philosophy of medicine. I am open to whatever is most beneficial for the person who is struggling. And usually the aim is, can we find something meaningful for them that they can actually do? If there's anything that I've learned over the years, it's do not burden somebody with even something good if it's not something they can translate into something meaningful for themselves. So what I hope you will take away, even principally here today, is if you do the basics well, you're probably doing the bulk of what you need to be doing. So in a time when people are very, very much interested in hacks, in quick ways to try and improve function, I have remained, you could say, in the dark ages, believing that, again, doing the basics well and consistently well is what contributes to optimal, as I said, health, function, and well-being. So I have three sort of levels that I normally look at when it comes to managing health and well-being. The first is foundational, and I've already mentioned the kinds of things that are involved there. It's very unhelpful, in my opinion, to try and deal with something that is as complex as the body with a sort of a sniper approach. In other words, I would say that a person who comes looking for a specific supplement for a specific condition, who is not getting enough rest, who is not eating reasonably well, who is not paying attention to exercise, who's not smiling, at some points in the day, who's still smoking and drinking and doing all of these kinds of things, I would say they are missing the point. So fundamentally, when it comes to optimal health, I would say to you that the body has a goal, and the goal of the body is to survive for as long as possible. So that is not something that we need to go ahead and try and do for ourselves. The body is going to do that in its incredible design on its own. What we want to do is we want to facilitate that. And as I said, we facilitate that primarily through the basic everyday lifestyle things. So immunity is naturally the kind of thing that we want to look at when we're considering infection primarily, although there are other kinds of conditions that the immune system plays an important role. But the idea, again, is when we're dealing with ourselves and when we're dealing with children, especially where the infection rates tend to be substantially higher, we ordinarily want to, as I said, reduce the frequency, reduce the intensity, and preferably reduce the duration of whatever condition we might be sitting with. So the things that I've been seeing sort of over the last 3 months, because we typically go through cycles, and there was one of the questions that suggests you've been seeing it too. We've been seeing, obviously, a number of upper respiratory tract infections with a lingering cough. So we've seen people who are sitting with coughs that have been persisting for weeks, and usually those kinds of things are not that responsive to conventional treatments. So we will address that at one point. The other thing that we've seen quite a bit of is gastroenteritis. So there have been quite a few people who have been having sort of diarrhea and vomiting and abdominal pain. So those are the typical kinds of things that we would ordinarily see just in day-to-day life. So before I look here, I will say to you, is there anything that somebody really, really wants to ask now or needs a little bit of clarification in terms of my approach or anything like that? We can get that out of the way. If not, I'm happy to jump into the questions. No? We're good to go? Okay, there was one question. Let's start with number one. Let's go through it like that. So the question is, I think they said they might put it up there for us. What are the signs that I should keep my child at home versus send them to school if they are unwell? That's such a good question to have to ask, because what we realize is even if there are guidelines, strict guidelines with regards how long a particular condition is contagious for, none of us are following it, right? So what we'll find is, say, for example, if there is an upper respiratory tract infection, as we knew with COVID, there was a time where, from when we were first exposed to when it first manifested in terms of symptoms, could take some days, right? And with most of these kinds of things, from exposure to the presentation or the onset of symptoms is anywhere between 24 hours, 48 hours, into as long with some of the things like COVID as a week, right? Typically, the things that have a longer sort of prodromal phase, those are the kinds of conditions that we're not ordinarily seeing every day. So the idea is you're probably contagious just before symptoms begin. So your kids are going to school then, probably. You're contagious pretty much for the duration of the acute phase of your condition, which could be anywhere, right, between 4, 5, and 10 days. And you're probably shedding and contagious for a period of time after that. So every time your kids get sick, you should keep them home for 3 weeks. No? Of course not. Exactly. So what I'm saying is, again, and what a great way for us to begin, if we're not practical about this, then it's a waste of time, to be quite honest with you. Because at the end of the day, we can sit and we can say, well, let's get technical. Life has technical components, but in life we have to be practical. So I would say to you this: if you have the opportunity and the privilege of being able to keep your child home for longer, do it. For the sake of the child and the other people who are otherwise going to contract the condition. However, think about the situation where you've got 2 working parents, you've got a 2-year-old who they don't necessarily have the additional help at home. That child has been feverish for 3 days. There's pressure from the work on both parents. Those parents are fatigued, right? The parents themselves have probably picked up whatever else was going on. They need to soldier on, and that child for the first time now doesn't have a fever. The child is still, riddled with mucus. The child is coughing. The child is still having these kinds of symptoms. Unfortunately, the reality is those parents are likely to send that child to school out of sheer desperation. And the reality is that's a major contributor to why these types of conditions continue to persist and, cycle through. When we think again about COVID, and I haven't thought about COVID in a long time, really. It's there. We see it from time to time. We no longer test and those things. But that's already my third reference to it. What I'm looking at is there were times when we would say if you had symptoms, there was a period of time, initially 10 days, that you had to be isolated. And that was because the understanding was it was contagious for that period of time, so you needed to keep people away. And that shortened down to 5 days. And what we realize is that as the time progresses, the communicability reduces. So one becomes less contagious as the time goes. But different people will continue to shed differently to others. So principally, here would be my take. If you can, again, keep your child home, for what reason? For their good, for the good of the people around them. If you can keep them pretty much well hydrated, most of the types of conditions that get in the way nowadays are what we call self-limiting, which means they are going to get better on their own. What you'll see is typically symptoms of a mild upper respiratory tract infection may reduce within 48 to 72 hours. Sometimes it may linger a little longer than that. A severe flu might persist in acute phase for up to 7 days. So you might even have a child or an adult who persists with fever 4, 5, 6, 7 days. And then after that, another 2 weeks of mucus and cough and fatigue. So look at the child. Does the child seem to have their appetite back? Does the child seem to, be otherwise back to normal, but persisting with some mucus and cough? That's probably, 4 or 5 days in, and that's probably by the time you're sending them. So in that situation, one says, depending on the age of the child, depending on the age of the child, you might communicate to them, listen, you have been sick. Try and be a little bit more careful in terms of what you're going to share with other people, in terms of maybe food or lunch or gadgets or anything else. So we try to educate them along the lines of reduce your tendency to communicate infection on the basis of try and wash your hands, try and keep things clean. The danger there is we sometimes push them into a point of absolute paranoia, and you get some kids who are paranoid about washing hands and everything, which is another issue we had, obviously, COVID-wise. But generally, I think if we can take a reasonable approach to these kinds of things, we're going to do as well as what we can. Simple fact is we're not going to get rid of the everyday colds and flus and types of things that we have, but I think we can reduce them with that approach that is reasonable. As I say, if you have the privilege of keeping them home for longer, do that. And recognize that there are going to be parents who will send their kids, usually not because the parent is careless, usually not because the parent is ignorant, but usually because the parent is struggling or desperate. And I think that there is a point there where one wants to just recognize that's the mix of how we live, and that's going to be part and parcel of our lives. So there isn't a specific date or time, but I would say to you, if again, your child is still feverish, that does not mean, or that would mean please try and keep them home. If the fever is down because you're giving them Panadol, that doesn't count, okay? The fever has to be naturally down, in my opinion, absent for at least 24 hours before I would be considering sending them back. Any specific question relating to that? Because the entire discussion could go around that today. Anything specific there that you would like clarification of? Say again?
Well, there is an opinion that the more child gets sick when he's little or whatever,
Yes.
This is the way he's building the immunity. as well.
I'd say that's more than opinion, that's fact.
Yeah,
I
so
would say to
keeping
you,
other children home, reducing it, reducing building their opinion. Again, it's another opinion, or this is what I've heard, that when we were all locked down,
Yeah.
so our immunity went down. That's why we are getting sicker more often, because we were kind of isolated from bacteria and, I don't know, viruses. I don't know if it's true or
yeah,
not.
no, absolutely. It's called the
That's-
hygiene theory of disease. In essence, when we become super sterile,
Yeah, exactly.
our bodies
That's what I
do
was
not,
trying to say.
100%. Remember what I was suggesting earlier, that child is probably still contagious no matter what point you send them in, back. You are not going to keep them home until they are no longer contagious. So what one's looking at in that situation is, that is how specific immunity develops. So through exposure, when I mentioned the time frame for how long a person typically is sick, what you'll find is those first few days, 3, 4, 5, 6 days, the immune system is dealing with things in a broad kind of way. It's not targeted immunity yet. When the body has been exposed to something, it takes about 6 to 9 days before it's able to produce an antibody specific to the infectious organism, which is why most of these types of conditions do not linger beyond about 10 days, right? So in terms of exposure, we will have enough exposure, that I assure you, right? So we needn't worry about that. But in terms of the frequency of illness, I'll say to you, whenever I sit down with a parent who brings to me typically a child under the age of 4, that's when I get to see them for the first time. And what you find there is the complaint is, this child just seems sick all the time. They get better, I send them to school, and 2 days later, this child is sick again. What's wrong with them? And my response is nothing, right? My response is, there is probably nothing wrong with this child. This is a normal response to exposure. So one looks at that and says, the average child in the average type setting under the age of 4, or even probably under the age of 10, I see a distinct difference from the age of 4, but generally speaking, is going to have between 6 and 16 infections a year. That's normal. That's not an unhealthy child. That is a child who, think about it, gets sick, and as I mentioned already, those symptoms might persist for as long as 3 weeks. Multiply 16 by 3 weeks. What do you have? A whole year of illness, right? So the parents who are experiencing this, and that's oftentimes pronounced when you have 2 kids at home, one's 2 or 3, the other one is just born, which relates to in fact, the next question. With a newborn baby at home, I'm afraid my older children go to school and could bring back a virus. Don't be afraid, it's guaranteed, okay? I am a firm believer in surprise is unhelpful. So if you're expecting it, you won't be surprised. You might be unhappy about it, but you won't be disproportionately unhappy about it, okay? So I have the newborn, and 2 children in primary. In my experience, both in practice and in family, the most difficult time within a family is when you have a child between the age of 2 and 3 and a newborn. That is the most difficult time. Have a 3rd child, load increases, but it actually doesn't become more difficult in terms of managing. Actually, I think it's the sheer, sort of overwhelming experience where you've been giving the first one everything, and now all of a sudden you sit with, how do I divide my attention and my time? And this one was more demanding than ever, and this one I need to take care of. And it's just a really tough time, and especially for moms, right? Especially for moms. So in that situation, here is my practical advice again. The kids are going to come home and they're going to bring infection with them. It's a given. So the encouragement is, when they want to engage with the newborn, which is a good thing, right? When they want to engage, you show them or you help them. If you're going to, before you handle or engage with brother or sister, let's wash your hands, okay? And if we're kissing them, kiss them on top of the head, okay? Not smack bang in the middle of the face, okay? So the idea is, let's understand they are maybe not as strong as you are at this point in time, and that's natural, right? That's not to boost the child's ego. It's just to give them an idea of you dealing with something a little bit more sensitive here. And the idea would be, let's clean up. If it means a change of clothes when they get home, that's not a bad idea. If it means using some saline nasal spray, when they get home. In fact, as a practical tip, I would recommend every child on the way to school should have a saline rinse, and on the way home should have a saline rinse, right? I think that is something valuable. It costs virtually nothing. You get a little bit of fuss for a few seconds, but it will probably add tremendously in terms of reducing the frequency of infection. So the idea there is if your child is symptomatic, feverish, well, you're going to have to keep them apart for a little bit, right? So in that case, understand we're not sick. We don't want to go ahead and make the little brother or sister sick. So until you're feeling better, let's try and separate. And I think it's always important with children, with anybody for that matter, be open, be clear, and help them to try and understand the situation as best they can so that they then contribute to helping in the management of that rather than being an obstacle in the process. So expect your kids to bring illness home. Understand that the majority of those infections are going to be self-limiting. Usually they are not going to develop into complication. And one can offer some sort of barrier-type protection, again, whether it be washing hands, whether it be a change of clothes, whether it be contact in areas that are unlikely to go ahead and spread that infection. Those would be some practical ways of generally reducing the likelihood or the possibility of the little one getting sick, okay? Anybody who's got a little one under 3 months, just a point of reference, any fever in a child under 3 months, take them to the doctor immediately, okay? Children under 3 months don't ordinarily get fever for nothing, okay? Child over 3 months, not that there's a magic mark there, but a child over 3 months at this particular stage, the body is starting to develop that non-specific immunity substantially better, and mounting a fever response, which is part of the dealing with the condition, is important and will be there. So any child under 3 months who starts with a fever or any type of respiratory distress, are on the side of caution, take them to the doctor immediately, okay? Something else important, when you have a child who is ill, who has picked up, again, an upper respiratory tract infection, which is just a broad term that we use for colds and flus and those kinds of things, and they're the bulk of the conditions that we see. If you find, for example, the child has a low-grade fever, even a higher fever, with fresh symptoms, sneezing, coughing, just lethargic, loss of appetite, that kind of thing, and they improve after 3 or 4 days, whether that's with or without treatment, and then a day or two later suddenly dip, okay, sort of that double dip scenario. Usually at this stage they look more sick than what they were. They're more lethargic. They usually have the fever that is oftentimes higher, and oftentimes they're complaining of pain. That scenario is, this is a most likely secondary infection. And a secondary infection is the infection that we treat typically with antibiotics, okay? So primary infections, those initial upper respiratory tract, are for the most part viral. As I said, they are self-limiting. There is absolutely no indication in that situation for antibiotic use. So the frequency of infections that I mentioned, let's assume we're having between 6 and 16 infections a year. I would say to you that max, there should be potentially 1 course of antibiotic in that phase, max. Not because, oh, we've used our antibiotic, we can't use anymore, is because if we are using, we're using them most likely inappropriately. And the overprescription and the misuse of antibiotics is causing a whole other issue, and it has been noted certainly for the last 20 years, but has progressively, I would say, over the last 5, become more of a known issue, and certainly doctors are tending towards saying, I don't want to have to give an antibiotic unnecessarily. So if that is your doctor's approach, stay with them. Oftentimes we think, well, the doctor's withholding a treatment that is important. If your doctor is not willing to give an antibiotic, trust them, right? Because the natural inclination is to prescribe. So if we're withholding a prescription on that, that person has probably done a sufficient examination, has taken a sufficient history, and is probably making the right decision, just to encourage you to manage supportively, whether that be through the use of just symptomatic management, or whether that be through the use of some complementary and alternative medicine, whatever that might be. Again, the vast majority of the conditions are going to get better without the intervention with an antibiotic. Okay? Make sense? We covered the first two. Any other questions on the back of those two? Usually, sure, of course. Absolutely, and what a great point. All of this is a matter of managing risk. What's the risk of intervention and what's the risk of not intervening? That is basically the decision that the doctor has to make. So if you present it to the doctor and there's a double dip type scenario, and the doctor then examines, they look in the ear and they say, we're sitting with an otitis media, or they listen to the chest and they say, we've got issues here, I'm hearing creps, or I'm hearing wheezes, or there's something that suggests some sort of consolidation, right? That doctor has usually the experience to be able to say, I have every reason to suspect that this is a secondary infection and that an antibiotic is appropriate. Well, we live in a day and age where we can test that. So if the doctor says, I think we're safe, there's no sign of dehydration, there's no other signs of any other issues, let's just be sure and let's wait 48 hours to get the test. In other words, they do a test, whether it be a swab or something along those lines. I know we get the rapid swab tests and that, fine, but they have their own issues. If we want a definitive diagnosis, usually that's going to take, if we're doing what we call a culture and sensitivity, when we're actually looking to grow something and see what it's sensitive to, that usually takes about 48 hours. So there'll be times when the doctor will say, I think waiting that time is unnecessary. I think we need to treat everything is suggestive of. And I think that that's a fair thing to discuss. There are times when one might look at doing a blood test. Bear in mind, if I'm going to expose that child to a painful experience, it better be worth it. So in my opinion, I would not do a blood test ordinarily if I have a high level of suspicion, knowing that this child is most likely struggling with a secondary infection. If you have a good clinical suspicion, I would say to you that it's reasonable, and let the person explain why they have a high level. If this is 24 hours, 48 hours, and they want to bomb with an antibiotic, I'd be like, what? I'm not sure. Again, if it is, this child's had a fever for 7 days, this child's had a fever for 8 days, this child is now, sort of fatigued to the point of this child is really not well, then by all means, do a urine test, do a blood test. And there are tests there that can be tremendously helpful, even non-specific. So you might do a test where the doctor says, oh, the CRP or the C-reactive protein, which is a non-specific inflammatory marker, is high. In my estimation, anything over 30 is an indication of a probable secondary infection. You get other tests like procalcitonin, which are newer kinds of tests that will give a high level of suspicion of a systemic bacterial infection like a septicemia. Those are not the conditions that we're talking about here. Those are the rare types of things that might happen, and you're not managing that at home. By the time you, as a parent, are looking at this child and saying, this is hugely uncharacteristic of my child. Parents know their kids. I would often say if a parent is willing to bring a child to me, it's because that parent is concerned. Now, I have some parents who the child, went, and they're there, and you're like, what's up with that, The reality is you're treating the parent there, not the child. But there is a process to that as well. And it all comes down to, at the end of the day, the parent's intention is always the same. How can I do what's best for my child? That's why the information that we have from a talk like this is intended to add some information. It's not to tell you everything about how to manage all the conditions. It's there to say to you, if my child has a fever, and 24 hours in, it's probably not a reason to panic. My usual cutoff is fever 24, or rather 48 to 72 hours. Okay. Are they drinking? Are they hydrated? If they've got profuse vomiting and diarrhea, well, that's a separate issue, right? Anything that is going to produce a risk for that child in the short term, hours, right, then get help. And that's the amazing thing here. I'll throw it in just because this is usually my response. People will say, in a case of emergency, which is the best hospital to go to? And my answer is always, the closest one, right? Because in that situation, the simple reality is the majority of hospitals are going to be able to cater for the typical kinds of problems. I sit with a case with a person right now with a very rare condition. I had heard of it, I'd never seen it before. Even her specialists had not had cases like this before. These are the kinds of cases where, you know, one sits for months trying to figure out what's going on with doctor's opinion after doctor's opinion after doctor's opinion. Those are not typically the conditions that we're talking about here. So again, we're on the safe side for the most part. The vast majority of conditions are going to get better on their own, which is why they sometimes say the doctor's job is to entertain the patient while the patient gets better on their own. Okay? A little bit of a joke, not quite that bad. But the idea is offer supportive management, good hydration, make them comfortable. The caution, and I'm just speaking sort of broadly now, the caution that I would have against using things that are antipyretic or analgesic, in other words, to drop a fever or make them more comfortable, I would usually only use that at night. And the reason I say that is because I would like them to sleep and I would like the parents to sleep. During the day, if you give something like Panadol to a child with an upper respiratory tract infection, usually that child is going to bounce back to feeling normal for about 6 hours. The worst thing to do. Why? They're going to run around wasting his energy and spreading their condition. So I would much rather have that child feeling bad, lying there, quiet, contained, right, and then help them with that at night. So that's my personal preference. The idea that we can take away fever just for the sake of taking away fever is a bad idea, right? And there's a whole other discussion and theory on that one. But I would say to you that in principle, if you just took the information that I've given you now, you would do a really good job at managing most of the conditions that you'll be faced with in terms of how do I manage them, when do I send them back to school, how do I try and minimize the spread. That's about as much as we can do, okay? I have been, again, in private practice for 25 years, and I have 3 children. One is nearly 18 in April, and 15 and 12, and we have had 1 course of antibiotics between them in that time, okay? And that was because she had a bullous impetigo, which means it's a big problem, okay? So what I'm getting at is that does not say that my family has had no infections. We've had them all, right? We've had the same as most other families. We've had the colds, we've had the flus, we've had COVID, we've had molluscum contagiosum, you know, the little spots that most of the kids end up getting. We've had most of the stuff, the gastros, the bronchitis, all of those things. The vast majority of those things, again, come and go, and to your point, do a great job at making for a stronger, better developed immune system that is targeted and typically then has people down the line saying, yo, this child was so sick, and probably around the age of 4, they seldom get sick anymore. That's usually going to be the kind of child who was managed well through those early times, and then is having a reasonable kind of lifestyle, which probably relates to the questions to come. So, any questions to that point? Anything so far? Yep? Okay. So let's have a look and see. Okay. So there's so much junk around, especially at birthday parties. We should just stop birthday parties. Good plan. Right? In lunch boxes, I really struggle with encouraging my child to make the right choices because there's so much easy options out there. How do you deal with this? As we know, a healthy diet creates healthy immunity. Healthy diet is a massive contributor to improved overall function, and the immune system is part of that. So this is a natural problem that all of us face. Why? Because there's a fundamental drive that every single person has. From the moment they're born to the moment they die, it doesn't matter where they come from, male, female, everybody is in pursuit and preservation of maximal satisfaction. And that mouthful basically says we all want what's best and nicest. That's what we want, right? So a child is not typically thinking about the consequence of this thing that they're doing now. Even a teenager, when you're trying to explain to them that this thing that you're doing is going to cause you problems down the line, it's not registering. It's not because they are stupid. It's the development is not there to understand sort of distant causal association. In other words, what I'm doing right now, even if it does cause that, I don't care because this is my deal. And the same is applicable to a child at a birthday party. You shouldn't choose any of the blue or the green or the red stuff, right? That's the colorful stuff that everybody else is eating, right? So in that situation, here is my opinion. There are certain things when it comes to nutrition. Food is primarily fuel, but it's also fun. So if your child is doing good things well most of the time, then the other things, let us smile, right? And here's how I would approach it. I typically approach it with what I call a value-add approach. So the child wants the chocolate, they want the Coke, they want the sweets, they want anything else. I say to them, you can have it after you've done something good. So for example, you want the packet of chips, you're welcome. Have the apple first. Have an apple with a half a glass of water and you're welcome to have the chips, right? So by doing that, here's what I'm doing. I'm ensuring that there is something good going in. Because when the child is only eating the other stuff, right, they lose their appetite for otherwise regular meal time. At least this way, I know that they've received something valuable. There is no perfect diet. There is no perfect food. It's a matter of, can I do something better than what I'm currently doing? So there's the deal. What a child will do is they are willing, to a degree, trade, because at the end of the day, you still have an element of power. You can't have this. It's not available. I'm not buying it. But if it is there and you would like it, help them understand that sometimes you earn things. That's a really good lesson to teach a child. I would like to be able to have the chocolate. Okay, you're welcome to have the chocolate, right, after you've had your broccoli. Always has to be broccoli. Broccoli, the devil, right? Has to be broccoli. I had a family I was seeing 2 weeks ago, mature, very, very educated parents who came in and said it was about the broccoli, and it was between them. It wasn't even the kids, right? So what you're looking at this point in time, as I say, is if I can add value first, it's probably the most successful I'm going to be in dealing with the typical exposure that I'm going to have at a birthday party or just by simply living in a developed place where everything is available, right? So some people might say, oh, no, you have to be super strict. You know, they're trying to raise this child vegan, whatever else it is. I'm like, knock yourself out. When that child's 6, good luck, right? The simple reality is I would much rather, for example, in my home, if you went into my home right now, you'd open the refrigerator, there'd be some ice cream. You'd open a tin, there'd probably be a couple of chocolates there. There are things there. Why? Because in many respects, I'm happy for my kids to know that forms part of life. But what I would like them to know is that's not all of life. And the bulk of what they need to be doing are the good things first. So my wife does an amazing job of having home-cooked meals that we, have together. And there is sufficient supply of good things. And you train them to make better decisions. Let me say, depending on the age of the child, there's a time when I think we need to be reminded that the child wants what's best for them on the basis of what's nice, and we want what's best for them on the basis of what's good, right? So we need to say there are certain times when we battle with our kids. We are willing to fight with our kids. Now people say, well, what? Here's what I mean. When I sit, especially with teenagers, and I see a lot of them, right, I will ask them, when you have the odd disagreement with your parent, no, when you have the continual disagreement with your parent, right, who are you fighting for? And they will inevitably say, I'm fighting for me. I say, that's correct. And I will say to the parent, right, when you are having this 19th disagreement by 9 o'clock in the morning with your child, who are you fighting for? What does the parent say? For them. So I say, let's establish the ground, sort of foundational understanding. Everybody's fighting for you, right? You are trying to find satisfaction through this. They are trying to find satisfaction for that. That's the difference. That is where perspective comes in. And when a child can understand, a teenager can understand that the reason you're willing to fight with them or have a difference of opinion with them or put instructions in place that they don't like, that you are going to enforce when they realize that it is an act of concern, not just, you know I love you, right? Well, I'm questioning that. You're making my life difficult here right now, right? The idea in many respects is, can I go ahead, help them be clear? I am willing to battle you on this because no matter whether you think so or not, whether you handle the iPhone better than me or not, I do know better on this subject. And I've had that discussion with my kids many times, right? And I will say to them, I will look at them very openly, you and I are going to have a standoff right now. And I want you to know this is a battle I will not lose. I don't care how long it takes. Why? Because I'm that committed to you. This is super uncomfortable for me. I would wish we were not doing this. But I'm willing to fight for you. That's what I'm willing to do. You'll be amazed as to how the attitude changes. Not immediately necessarily, because in essence they have to concede that they've lost. Nobody wants to concede that they've lost. But when you can have the conversation a little later to recognize that the battle was we were actually on the same side, then what you find is communicating things like what they eat and what they do becomes entirely a different story, right? Quite a few of the questions relates to how do I convince, how do I, get my teenager on board. There is a time when, again, you remind them that this isn't a collaboration. This is I'm doing what's best for you, and this is how it works. Now, that's more difficult to do when you haven't been doing it at the beginning. 100%. If you're not doing that at the beginning, it becomes more and more difficult. But it really, really is something that when we recognize and understand that what we are doing for our children, even when it's difficult, is for them, it allows us to, in many respects, stand our ground on better decisions more consistently. And usually when they understand and see that it is genuinely with good intention, they come around. That might take years. I noticed that between 12 and 15, they seem to not recognize that this is the battle stage that's for them. And it's like just, the contention is there because I understand why, but the point is usually when you manage it like that, not perfectly, none of us are perfect, none of us are going to get it right every time, but when we're able to get it right most of the time and really explain along those lines, diet will become easier, devices will become easier, friends will become easier, commitment to school becomes easier, respect for, other people becomes easier. All of those typical kinds of discussions that we have with our growing kids becomes clearer because it's a matter of we're trying to share with you and communicate to you things that will be helpful and beneficial for you. Make sense? So, back to the actual question, value add. Have this first, and then you're free to have that. And that's something that you decide. Okay? And inevitably, the child usually says then, yeah, I don't mind apples. In fact, I actually don't mind blueberries. And yeah, if we get raspberries, we'll be okay. And then it's like, get those things first. Okay? So how much time do we have? Another 10 minutes? 10 max? Okay. So again, how can I convince my child to improve their immune function with food or lifestyle, like early sleeping or colorful veggies? Okay. So similar to what we've just said, in that particular situation, it's less a matter of convince, it's more a matter of present the facts and then enforce. And I know that that sounds harsh, but it would be similar to me asking the question, how would you convince your employees to be at work on time? How would you convince your employees not to take extended breaks and spend most of the day on social media? How would you do that out of interest? Imagine you were the owner of a company and you had 4 employees and they were arriving late and they spend most of the time on social media or chatting around the, dispenser of whatever it is their preference. How would you deal with that as a boss? Okay, so great. Establish number 1, what's expected? Salary. In other words, there's something they're there for. There's something they want and there's something that you want. So in essence, the same principles would apply, right? Not to say it's a contractual agreement. The kid didn't sign up to be born, right? And you didn't sign up for that one. The idea is, again, you've got this one or these ones, and now you need to manage these guys, right? Help them along the way. So in that situation, I would say to you that it's entirely appropriate to help them understand. If you are not going to do what's required of you, make the expectations clear, then there are consequences. And again, I would say to my children, right, I'm going to make your life more difficult. I'm going to do that. Not because I want to make your life more difficult. I would love to make it much easier. How do you know that? Look around, right? When I ask a teenager, do you think your parents are trying to make your life more difficult? Like, always, yes. Yes. My response is, let me tell you how I know that's not the case. Because if I were your parent, here's how I would make your life more difficult. Give me back everything I've ever bought for you. Get out of my house, fend for yourself, okay? And I'm sending the police after you, right? If that's my intention, is to make your life difficult, that's what I would be doing. Am I doing that? No. Why? Not my intention. Because if that was my intention, I'm doing what I'm doing right now, I'm really bad at making life difficult for you. So the idea there, again, is communicate always the understanding that I'm on your side, but in more than just words, right? So how do I persuade them? Depending on the age, sometimes I spend less time persuading and more time clarifying what's expected with an immediate consequence and consistent in. We learn in many respects through consistency. I said it earlier, the child wants what's comfortable, okay? They are willing to do certain things that are uncomfortable when they consider the value of what they're having to do worth it. So in many respects, reward, appropriate consequence to not meeting the expectations. These would be the kinds of things that I would say are practically challenging, but helpful to facilitate the kind of behavior that at the end of the day achieves what we're looking for, and that is, how can I promote optimal health, function, and well-being? Okay, so I know that just to open that up is a can of worms right there, and there, be people who want to have long discussions about all of those things, and another time I'd be happy to do that, but it really, really comes down to, are you willing to persevere in doing what's best for your kids? That's what it literally comes down to. Okay. How do we engage teens on this topic? Okay. I think we'll see. We'll get to that one. It's one of my favorites, by the way. Are there natural remedies for anxiety before exams? Okay. So I certainly sit with some kids at times who are underperforming because they struggle in an exam setting. It's a given. There are times, I sat with a 24-year-old yesterday who's trying to write a major exam who is underperforming because of panic that sets in anticipation of writing, right? So this is something that we might experience throughout our lives. There are some things that I think are helpful at times to just quieten that nervous system. There are some techniques, and the young lady on my left will have good answers for that. But there are some natural products, and they're available sort of freely in the pharmacies now. There is a homeopathic called Nurexan, if you want to write it down, Neurexan, Nurexan. It's a homeopathic that is, I find, works better for much younger children. It's completely safe. You're not going to overdose, typically for just quietening the nervous system. And the second one, which I think is typically a bit better, is a thing called Calm Valera, C-A-L-M, and then I never forget whether it's I never remember if it's an E or an A, V-A, Calm Valera. It's in a blue box, right? And it says for nervous tension, that kind of thing. So that comes in a drop form and in a tablet form. And I would say to you that those things, to put it, if it's in the drop form, in a little bit of water, depending on the age or the weight of the child, 15, 20, 30 drops even, in a bit of water, half an hour to an hour before, is certainly something safe. It's not going to interfere with their cognitive function and might just quieten things down a little bit. So that would be something particularly helpful. And then obviously having the kinds of discussions that are able to tell them that it's quite normal to be anxious. Here are some other things that you might be able to go ahead and do in terms of breathing, or some things that you can focus on. And at the end of the day, guess what happens if you fail this exam? It's not the end of the world. Oftentimes, by just relieving that amount of pressure, is a very helpful thing just to quieten things down. Obviously, you've got massive personality differences there as to why some people would be anxious and they keep getting 100% but remain anxious nonetheless. And you get those who are seemingly not anxious at all and are barely getting through. So you have to deal with each person accordingly. Okay. Maybe this is a useful one here. How do we choose among brands and produce? When it comes to supplementation, I'm a firm believer that in this day and age, the demands that we have in our bodies, just by virtue of our environment and exposure, and in terms of what we lack in the form of just, even good quality food, leaves us at a deficit. So when I say to you, when it comes to health, I look at foundational health first, do the basics well. The second part is we look at treating a given condition, if there's a condition. And the third part relates to, okay, what do I do when those two things are in place to facilitate optimal health? How do I get the most that I possibly can out of my system? I think it's almost impossible not to, or to get there without supplementing. So the kinds of general guidelines I would look at is most companies nowadays that are promoting good supplements are going to tell you that with supporting by saying things like food derived. In other words, the supplement that you have, if you look on the ingredients, you'll see names of foods. When you're looking at an ingredients list and you're seeing chemical names, it's supposed to be a supplement. A nutrient is something that is going to be taken on by the body and part of the building and the repair and the function. They are biochemicals. You get those types of things in plants primarily. Phytonutrients, and that's where we get the bulk of our micronutrients from, our vitamins, our minerals, our cofactors, those kinds of things. So the idea is look for the kinds of supplements that have on the label reference to the foods that are in there, okay? And as I said, if you look at certain brands will claim that. They will say, we are a company that aims specifically at providing as natural a source as possible. Synthetic supplements they dominate the market. They are chemicals. They are components of nutrients. They are not usually complete, and they have a drug effect on the system more than they have a nutrient effect on the system. So without everybody now learning how to go ahead and read a label, if you're looking to supplement, the idea is, can I replace what is missing? Well, what's missing? Sufficient things in my food. Well, am I getting something in food? So I am very much in favor of having powdered supplements, such as a powdered broad spectrum, shake, whether it be fruit and vegetable, whatever it might be. I find those are the best ways of going to supplement, which probably is useful to say. Somebody asked here specifically, what kinds of foods, or what is the requirement for vitamin C in a 10-year-old, doesn't like to eat fruit, fine with veggies and that, we don't like to take supplements. How do I go ahead and get that child to get what they need? First thing is, I really don't support, for the most part, the idea that we use isolated supplementation. It has to be vitamin C, it has to be magnesium, it has to be this. It doesn't come like that in food. It comes as a package. So generally speaking, I would say we want to go ahead and give that which is a combination, which again is food. Now, does that mean we never give isolated nutrients? No. There are times when I'm looking to treat a deficiency, which vitamin D is the most obvious. Lots of people are D deficient. Well, we give D, right? But ordinarily, I'm not going to go ahead and just give an isolated supplement with the idea that that is going to be good for overall nutrition. I might give something specific for a specific condition. Not the same thing. We're talking about how do I supplement. Again, find something that you could give on a daily basis that is a broad spectrum, not specific to C, but something that would have most of the other things in there. And again, when you read the list, it says broccoli, and it says kiwi fruit, and it says blueberries, and it says mangosteen, and it says whatever else is in there. That would be my recommendation. And how would I get that into a child? I would turn it into a really nice tasting smoothie, and I'd give it to them every morning. We lived like that for many, many years. There was a stock standard breakfast in our home put everything into a really nice tasting, and everybody had breakfast together like that. So that is a very helpful way. Yeah.
I think I can manage that microphone. What do you think about gummies, vitamin gummies, omega-6 gummies, and also probiotics? Which is the best? Thank you. Which is the best form to give a kid probiotics?
Okay, my view on gummies, they look good, they taste good. Okay, that's typically what you find in those kinds of supplement ranges is the company knows that the child is not going to take it, so we try and present it as fun and sort of palatable as possible. There are some companies who seem to get that, do a better job of that than others. I do not think that you are going to get out of a gummy, for the most part, the kind of optimal nutrition that you're going to get out of food, right? However, if this child, at this particular point in time, you're not going to leave here and all of a sudden tonight your child's eating a buffet of fruit and veggies. I'm under no illusions that that's going to be the case. So in that case, I might well say, I think it's worth giving your child a broad spectrum vitamin and mineral, whether it's in the form of a chewable or a gummy. It's got fillers. It's got those kinds of things. But that's the trade-off in many respects. And there are some brands, there are some options that are better than others. So if it's purely gummy and it costs 12 dirham, you probably need to think, well, I'd rather buy them another sweet, right? If it's something that, again, you're looking at it and there's reference to the food kinds of things and it happens to be in that form, well, better than nothing. So this, again, is a matter of, I don't have to get it perfectly right. Can I do a little better than what I'm doing right now? In my mind, that would be stepping reasonably in the right direction. Okay, I think I have 2 minutes left. Any final question, right? Anything that's really stand out that I've missed? I mean, it's just a chat, really. It's a conversation more than anything else. And I think we've covered actually a lot of ground. And my intention at the beginning was, as I said to you, take something away. Take one thing away or two things away that you can go ahead and use sort of immediately. I hope that we've been able to achieve at least that. Yep. Any final questions? Yes. Immunity, in many respects, when one's looking at the different facets, so there's that non-specific immunity, which is typically saliva, tears, skin, gut, probiotics, which I didn't answer, sorry. With regards to those things, there is a continual exposure that's required throughout life to maintain certain levels there. So there is an accelerated growth and development, as with all the systems in the body, through the earlier life. But there is no question that throughout life, the immune system is continually adapting through exposure. So a person may never have had a particular condition until they're 40. Then they have the infection. The body still is going to produce a level then of targeted or specific immunity. Immunity does decline with age, but it declines probably more so with the kinds of behavioral changes that are accompanying age. Less physical activity, less, of the kinds of things that contribute to better overall health and well-being. So not really the subject, but aging, as we see it, as a decline in function for most people, is deconditioning more than a chronological adding of years. In other words, our lifestyles change to contribute to less functional well-being, which is why I would encourage a 90-year-old to try and be active and eat well and do all those kinds of things, because the body still responds best to that. Okay? Good. Thank you for your time.
Thank you so much, Dr. Ryan. We're so grateful to have you here. We know how busy you are, and we booked this months ago, actually, because it's hard to get you. So thank you so much for your time. I think that was really nice and practical, because we all agree there's so much information out there, and it's extremely confusing, and you've just clarified that. Thank you.
Pleasure, I hope so.
And we hope to see you back soon.
Thank you. Thank you for having me. Enjoy the rest of your day.